Hello, friends, and welcome to the COMLEX Instant Podcast. Let's start out by talking about cystinuria. This is an autosomal recessive failure of the tubular resorption of cysteine and certain amino acids such as lysine, ornithine, and arginine. So, on the board exam, if you see a patient with cystine stones, that's a common tip-off for selecting cystinuria. Also, the treatment is going to be hydration, basically to increase the urine volume, and alkalization of the urine with bicarbonate and acetazolamide. Remember those two key things, bicarb, acetazolamide, and then also hydration. So on the board exam for cystinuria, make sure you know that lysine, cysteine, ornithine, and arginine, LOAC, LOAC are the key amino acids that are involved because of the failure of tubular reabsorption. And also, the next condition I want to talk about is Diamond-Blackfan syndrome, which is basically a pure red cell aplasia. So with that, I mean that it's a congenital or acquired deficiency in the RBC stem cell. Okay, what happens is that there's a congenital condition, sometimes resulting in abnormal facies, cardiac and renal abnormalities. So those three things, the face, the heart, and the kidneys, are having some sort of a defect because of the deficiency, which can be congenital or acquired, in the RBC stem cell. It's called Diamond-Blackfan syndrome, and the treatment is going to be steroids. What is de Quervain's tenosynovitis? The two key things you want to remember is that it causes pain upon flexion, that's the key word, of the thumb, and the muscle involved here is going to be abductor pollicis longus. So remember that. Now let's review DiGeorge's syndrome. Well, here you have an embryologic defect in the development of pharyngeal pouches that leads to thymic aplasia. So pharyngeal pouches, thymic aplasia, both of those result in T cell deficiency and also parathyroid aplasia. Most commonly, a patient will come in with tetany. Those are the key words. And the tetany is due to the low calcium levels. So a patient with hypocalcemia, which is again secondary to that hypoparathyroidism, and there's recurrent severe viral, fungal, and protozoal infections. So on DiGeorge syndrome, a common thing they like to ask also is the QRS complex changes on the EKG with the hypocalcemia. Again, it's going to get a little bit wider. So remember, tetany with hypocalcemia secondary to hypoparathyroidism with recurrent infections is going to be DiGeorge's syndrome. Next, I want to talk about Ehlers-Danlos syndrome. With Ehlers-Danlos syndrome, the most important thing that the boards will want you to remember is determining the associations. Well, the main association here is going to be mitral regurgitation. That's the key heart association that patients have. And also the second most common is the association with the knee, where patients have a knee that's fixed in hyperextension, okay? And the genu recurvatum of the knee, that's what it's called. It's an autosomal dominant defect in collagen synthesis where patients have increase in skin elasticity. So a key word there, skin elasticity is increased. You're thinking of Ehlers-Danlos, and start thinking about mitral regurg, the recurvatation of the knee resulting in a fixed hyperextension position along with aortic dilatation. So those three things are going to narrow your differential to Ehlers-Danlos syndrome. What is Dressler syndrome? Dressler syndrome is a condition that's typically 2 to 4 weeks after an acute MI or after heart surgery, and patients develop a condition such as acute pericarditis, and it may be due to an autoimmune reaction to the myocardial antigens. But the classic scenario is any patient who has a acute pericarditis after 2 to 4 weeks of an acute MI or heart surgery is considered to possibly have Dressler syndrome. Now, what is Elise van Creveld syndrome? This is a simple syndrome of polydactyly plus a single atrium. Okay, so it's a syndrome of polydactyly and a single atrium. What is Erb's paralysis? This is a waiter's tip where there's an upper brachial plexopathy from C5 to C6. Now, what about Evan syndrome? Well, Evan syndrome is a condition where patients present with thrombocytopenic purpura, hepatic cirrhosis. They can also have, hemolytic anemia with a thrombocytopenia, leukemia and sarcoidosis, along with Hashimoto's. So a lot of um, hematological conditions, along with sarcoid and Hashimoto's thyroiditis. And in general, for these conditions where you have immunoglobulin IgG autoantibody mediated auto mediated hemolytic anemia, patients will have treatment with prednisone and intravenous immunoglobulin. That's going to be most helpful. So let's recap Evan syndrome. IgG autoantibody mediated hemolytic anemia. Patients have an association with collagen vascular disease, TTP, hepatic cirrhosis, sarcoid, Hashimoto's thyroiditis. But the most important thing is that hemolytic anemia and the thrombocytopenia. You treat it with intravenous immunoglobulin plus prednisone. What is Fanconi syndrome? Well, Fanconi syndrome is a very high yield topic for the boards because it's associated with renal tubular acidosis type 2, and it's clinically seen with patients who have glycosuria, hyperphosphaturia, hypophosphatemia, basically due to vitamin D resistant rickets. Also, patients have systemic acidosis, polyuria, and polydipsia. So the key points here you want to remember for Fanconi syndrome is the RTA type 2, also the hyperphosphates, okay, in the urine, but having hypophosphatemia, okay, in the serum, and that's secondarily due to the vitamin D due to rickets. Patients have amino acid uria, and it's not cysteine specific though. And patients have acidosis, polyuria, polydipsia. So it's very easy to confuse with something like diabetes or even confusing with cystinuria if you're not careful in reading the question. The dysfunction is mainly of proximal renal tubules. It can be congenital or acquired. And commonly patients have presentations with the use of certain drugs or multiple myeloma or toxic metals. So that's a common board review scenario that you want to keep in mind. Now let's talk about Fanconi's anemia. What is Fanconi's anemia? Previously we talked about Fanconi syndrome. Now we're talking about Fanconi's anemia. This is an autosomal recessive disorder of DNA repair. Patients have bird-like faces, cafe au lait spots, congenital urogenital defects, short stature, urogenital defects with possible retardation, and absent thumb. Again, it's autosomal recessive disorder with pancytopenia, increased risk of malignancy, short stature, and bird-like faces, along with cafe au lait spots and congenital urogenital defects causing retardation and an absent thumb. That was a quick board review of some of the most common syndromes you may see on the board exam. Please visit COMLEXFlashcards.com for additional lectures on how to prepare for the COMLEX board exam, and good luck in your preparation for the boards.